If you're in the military and you're not using these benefits, you are literally leaving thousands of dollars and sometimes life-changing treatments on the table. Leading right out the gate, we're going to talk about LASIK and PRK. These are actually very near and dear to my heart because I had the PRK, which I believe stands for photoreactive keratoconus. LASIK is where they fix your vision. Everybody knows that. PRK is the same. It's just a different type of procedure. I had PRK done back in 2018 while I was in the Marine Corps for free. I had dog vision. Now I have great vision. Thank you to the military. This is an elective surgery that you can have if your vision sucks, especially if you're in, an important role. So I was a truck driver, transportation logistics guy. They want me to have good vision. Pilots, same thing. There are a lot of different jobs where if your vision starts to get iffy, they'll boost you on the priority list and you can get it done in the military for free, which is a wonderful benefit. I'm incredibly happy that I got that done. Number 2 is functional rhinoplasty. Rhinoplasty is nose jobs. Now, this is not a cosmetic thing where you're like, I don't like my nose, so fix it. This is if you struggle to breathe correctly, right? Like if your breathing is impaired, they can go in and fix it. I actually had a buddy who just got this done. Now, he did it after the service, but it was covered. However, he did this after service, but had he done it while serving, they would have been able to cover it. I actually wish that I'd known about this one because this is an issue that I've had and I'm actually exploring getting this fixed myself. I really would not have minded knowing that this was an option while serving because I would have gotten it done. Number 3 is the vasectomy. And yeah, I've had this done as well. The same is true for like the lady side where if you want to have, your insides scooped out, they can do that as well. But it's much more common for men to get the vasectomy while serving because that's like a super quick, you don't even get sedated procedure. Outpatient, I believe is the right word for it. But yeah, vasectomies are very common. A lot of service members and vets get them done. TRICARE will pay for it. It's wonderful if that's what you want. Number 4, boob jobs. Now, technically, they do not do this just because you want it, technically. Now, it is much easier, I will say, to get a breast reduction approved. So if you have, if you were gifted with large melons and it's got, you got some shoulder, back pains, whatever, it's pretty common to get breast reductions paid for in the military. That said, getting a boob job, right, implants, not necessarily as common, but I know quite a few people who got this done on the military's dime. Now, the main way that this works is if you tie it into a mental thing. So like a mental health qualifier, i.e. like anxiety, depression, whatever. Like if you get that side of things done, I've seen that done, but it's actually more common. And I'll talk about this in a little bit. Surgeons who want to be cosmetic surgeons after the military need to maintain some level of practice to step into that role. And so often, especially towards the end of like a fiscal year, they will offer these cosmetic procedures to service members. There are more than just boob jobs. There are other options. And they'll do it at cost so that the surgeons learn and it doesn't cost the military any money. So that's another way you can get this done. But yes, you can get it paid for completely or at cost, depending on how you play your cards. Number 5 is a cleft lip or a palate repair, right? So this is like when you see people, their lip is kind of like stuck to their nose or, it's called a cleft lip, cleft palate. The military will pay for this. That one's pretty straightforward. Number 6 is braces. Now, this is specifically more if there's like bite issues or jaw function issues, speech or chewing impairment. They also have they can do like TMJ, like the, your jaw popping, like that surgery as well. But braces are fairly common in the military if you have actual issues, not necessarily just for cosmetic, but if you have reasons like bite, where they need to fix it, they will pay for that in the service. I knew quite a lot of people who got this done. Number 7 is your wisdom teeth. I kind of say that jokingly because I got told that I was getting my wisdom teeth out at boot camp. There was no choice. It wasn't an elective thing. It wasn't something I cared to do. They just got pulled. So often if you're at recruit training, they will just yank your wisdom teeth and be done with it. But if you make it through that point, at least that was my experience. If you make it through that point and you want to have your wisdom teeth removed or there's any issues, they will pay for that as well. Number 8 is varicose vein treatment. So if you have varicose veins, sometimes that, I guess, causes some issues, and they will fix that as well. I don't actually know anyone who had that done, but doing some research, it can be fixed. Most military finance books are trash. The one I wrote actually helps service members and vets. So scan the QR code, click the link down below in the description, and grab your free PDF before you waste another paycheck. Number 9 is scar revision. This is going to be dependent on if it's like framed as pain, like limited movement, psychological distress. So like, if you got a paper cut and you have a tiny scar, they probably don't care. But if you have like, surgery scars, like I have a surgery scar that still to this day itches, that probably is something they could have or would have been able and willing to fix. But, it doesn't bother me that much. But like those kinds of things where it's painful or it might limit movement, or maybe it's like something that really does mess with you psychologically. If it's in a really weird spot and it's just a scar that you like have to deal with all the time, like explain or whatever, it might help you with that as well. But it can be done. Number 10, paniculectomy, which is excess skin removal. So now this could be for like if you have rashes, infections, hygiene issues, mobility issues. Like if you have legitimate issues for like rashes, infections, hygiene, mobility, they will remove skin. In some rare cases, I've understood that if you lost a significant amount of weight, they could help with that as well. But this is, again, not the main purpose for this, and so I wouldn't bank on it. Number 11 is a deviated septum, which is like, kind of back behind your nose or whatever. I have a couple friends who had that growing up, and the military will take care of that. I had a friend who got that surgery. I think 2 friends who got that surgery while in the military, but that's something you can elect to have done as well. And then I want to touch on this because I know you guys care. The on-base cosmetic surgery programs, right? So some military hospitals offer cosmetic procedures that are done by surgeons for training. Now you pay out of pocket, but it's going to be way cheaper than if you went to a civilian because it'll be at cost, and you get high quality surgeons because they're trying to keep their certifications up to go be a plastic surgeon down the road. And this is practice and training. So that's not necessarily free, but it is incredibly cost effective compared to other options. But again, I know a lot of people who got cosmetic surgeries for various reasons while they were in. That's just, and covered completely. That's just not necessarily a guarantee. So here's the deal. If you want something like this approved, you need to think like this. You need to tie it to function. So if there's pain or performance, if there's mobility or breathing or vision or some kind of issue that is not functioning correctly because of the procedure, or that the procedure you want could fix, they will fix it. You also need to document everything. Multiple appointments, failed conservative treatments, impact on work, like pay attention to what actually is being affected here and document all of that. And then you got to make it a readiness issue. So like tie it to like, hey, this really affects my ability to do whatever in my job. Like I said, LASIK PRK, driving trucks and logistics, vision is beneficial. Pilot, same thing. The bottom line is that the military will pay for dental readiness a lot more than people actually believe or realize. They'll pay for vision correction. That's actually fairly common. There's usually a wait list, but it's common, especially if mission relevant. They're going to fix like functional fixes that might be disguised as elective, like things that actually, like if your finger didn't work the way it should or whatever, they'll fix that crap. And they'll do like all kinds of reconstruction and legitimate medical issues. So like, for example, we had a wrecker operator when I was in Afghanistan. She was undoing a chain binder, and like one of the old school ones where it's like a lever, and it snapped, and not in a good way, and it shattered her jaw. And, they reconstructed all of that, everything. And it was obviously on the military's bill. Now, these are like crazy medical procedures people may not know that the military would pay for. And a lot of these are elective or like nice to haves, but obviously they're going to cover anything else that comes up. Like my appendix almost ruptured on duty. They covered that. Have no idea what that would have cost. My knee surgery, that was covered. Any of those types of things are absolutely covered, but these are some of the like more interesting ones. Like, I want to know, comment down below, what medical procedures did I miss? What are some crazy things you've heard of people getting paid for by the military as far as medical procedures that you think other people need to know? Or which of these did you find the most interesting, or do you want to try to use while serving? Either way, hope you found this beneficial. Have a great day, everybody.